Hello, it's lovely to have you join us on this episode of Health and Flavor. Undoubtedly, curing a heartbreak is easier than curing a heart disease. Heart disease, otherwise known as cardiovascular disease, is notoriously responsible for 31% of deaths globally as conveyed by World Health Organization. What's better is that heart diseases can be prevented and about 80% of them are avoidable. My name is Bill Hawaka and here's a preview of what we have prepared for you in this episode.
1, 2, 3, 4, 5, 6, 7, 8.
Those are some of the common symptoms that are usually presented by patients with heart disease.
Okay.
And talking about the human heart, it's a very important organ.
Yes.
Everybody has one, and we have to take good care of it.
Yes.
There are various signs and symptoms that are associated with the heart disease. The commonest symptom for a patient with heart disease is chest pain.
Do you have a clue on how to keep a healthy heart? We randomly asked people on the streets, and these are some of the answers that we got.
Nowadays I eat right, I go gym, if it's not gym, as in I exercise a lot because I realize it's how our daily lives, like for me, I do a 8 to 5 job, the AM to PM job. So I sit, I rarely walk around. So you find in the evening I don't want to take an Uber to go home. So lately, I rather walk. Sometimes I just walk.
For example, I personally have taken interest of doing a lot of exercises. And this one I've been doing because it's an advice also I've gotten from some of my doctors, because if you don't do a lot of exercises, you find that your body becomes too heavy for you, and even the breathing itself becomes a problem.
The heart tests should be done more regularly than any other test. Yeah, because I realized that at times, due to the very many activities that we go through, stresses in life, we might end up having some stresses piling up, and later on it might affect our hearts.
It's good to regularly check because you don't know when it will hit you. Yeah, it's a one-time thing. Its effect is so massive.
How heart disease can be treated medically is extremely diverse, since the type of medication plan depends on how heart disease affects your cardiovascular system. In other words, not all heart diseases are the same, so they are not all treated the same way. Our medical expert had more to say on this.
Heart disease, in a very simple statement, these are diseases that affect the heart. And the alternative name for the heart disease is cardiovascular disease, which basically means diseases that affect the heart and blood vessels. There are various signs and symptoms that are associated with the heart disease. The commonest symptom for a patient with heart disease is chest pain. For most patients who may have this kind of pain, this is the pain that is pathognomonic, which is a very big term to mean it is definitive of a patient with heart disease. So maybe just for the sake of the viewers to repeat, it's pain that is starting on the left side of your chest, and you feel more of like a pressure pain and not necessarily a stabbing pain, and it rises from the left side of the chest all the way to the shoulders and then the inner side of your arm as it comes into your left upper limb. So you feel it in your left hand and not on your right hand. Yeah. So that is one of the commonest signs. The other one is now easy fatigability. You know, if you used to walk up to third floor without a problem, then you suddenly can't do first floor. You know, you go all the way to first floor and you have to take a rest. That could be a problem that can show us that you have issues with your heart. We have others like patients with heart disease characteristically may also have shortness of breath. And they breathe quickly, not because they've done something, but then even they breathe fast even while seated. You know, you are not going anywhere, you're just resting, and yet you are breathing very, very rapidly. The predisposing factors to heart disease are very many, and it's important that I explain to the viewers that commonly one of the serious predisposing factors is presence of heart disease in the family. So if anyone in the family has had it, then you may look at and think about yourself as a possible candidate. Of course, depending on the type, because we have different types of heart disease. The treatment for heart disease is more particular depending on the cause of the disease. Like I said earlier, we have heart disease caused by infections. So for instance, bacterial infection. This particular disease, which we can call infective endocarditis, is treated by the use of antibiotics, and strong antibiotics for that matter. We give them through the veins. We call that IV medication, intravenous medication. So that is how to treat the infective ones. And then we have heart disease as a result of other things. So for instance, the anatomy, the structure of the heart can have a defect. So things like those ones have to be corrected surgically. And then once they are surgically corrected, patient recovers. We have heart disease, which is as a consequence of increased blood pressure. We have heart diseases that are as a result of a problem with the electrical conductivity within the heart. So maybe flutters, the way the heart is pumping. There's a particular rhythm on how the heart pumps blood. So if it is pumping too fast, in terms of the messages, the centers, the electrical communication from a part of the heart, which I will only call the AV node, because I don't want to go into details. This part of the heart called the AV node is the one that gives the electrical conductivity. It sends the message, like now we can contract, now we can expand. And when that part of the heart has a problem, then it can be corrected with medication and also electrically. We have defibrillators which we put on the heart to correct the rhythm, to make the heart go back to a normal pumping rhythm. There are side effects to medication, especially for the ones that are swallowed. People react differently. The basic ones may include nausea, vomiting, things like diarrhea, problems in the stomach. We call that gastrointestinal issues, which may present like diarrhea. And then we have more complicated side effects to medication. And some of them may include allergic reactions on the body, where the skin can have serious allergic reactions. We may have, for very severe ones, we may have injuries to the organs, especially the organs that do the clearing of the drug from the systems in the body. For our patients who have heart disease, they are the best candidates for dietary and physical activity considerations in terms of helping us to manage. Their manage is wholesome. And so patients with infective endocarditis, which I mentioned, patients with enlarged hearts, you may also realize that patients with enlarged hearts may also be generally bigger in body size. So for the physical activity, we encourage such patients to be active. And active in the sense that they walk more, they should walk more, they should take the stairs, they should run if they have the time and space to do jogging, they can do that. They can get involved in sports. Some of the enjoyable and really good effective sports are like swimming. Swimming involves your whole body system. So as you throw your arms, throw your legs, the whole body is working, your heart is pumping, and so the whole system is really working out. So for patients with heart disease, we have some common dietary considerations that we tell them. So salt and sugar are things that patients with heart disease, we try to pull them away from. And then in terms of how they prepare their food, if it is meat, if it is protein, if it is vegetables, the best source of cooking style is actually steamed food or boiled food, where you do not include additional cooking oil. But in the event that they have to put that, then we encourage them to use the oil as opposed to the fat. Cooking fat is the solid one, but cooking oil is the liquid one, because at least most of those ones do not end up solidifying even when they get into the body. I would conclude generally by saying most of the heart diseases are very manageable, and I would like to request our viewers to first of all consider the annual checkups, so that they do that. The vitals, when they go to hospitals, they do not skip the part where the nurse says, I would like to take your vitals, because that's important for us in detecting the heart diseases. And it can occur to anyone. The beauty is that when we detect them early, then we're able to treat or manage early, and someone enjoys a good quality of life.
It may be appealing to think that there are foods that can prevent heart disease. Well, there is no magic food to decrease the risk of developing heart disease. The crucial part is to eat a healthy diet and keep our bodies well hydrated. Mr. Kefa, the nutrition specialist, gave us some knowledge on this while revealing facts that are rarely shared. Hello everyone, welcome to Health and Flavor. This is our nutrition segment. And on set we have Mr. Kefa Nyanumba. He's a nutrition expert. Hello, how are you?
Fine, thank you.
It's good to see you.
Good to see you
and
too.
It's a pleasure to have you here.
Thank you so much.
So then today we have a case study of heart disease. Yes. We have a 52-year-old male patient, and his name is Mr. Michael. That's not his real name. He has a heart disease. Yes. So then maybe you can brush through the heart diseases quickly before we got into the dietary history of Mr. Michael.
It's actually one of the conditions that many people experience.
All right.
And it usually refers to the disorders of the heart.
Yeah.
And it's important for us to know that everybody has one heart, and therefore we need to take good care of it.
Sure.
Yeah, in the case of Michael, he's complaining of chest pain.
Yes.
This is usually in most cases on the left side and not the right side.
Yes.
It usually starts from the left side. He's complaining of nausea. And all those issues actually need to be addressed. But we are going to go through the dietary history before we come to the nutrition intervention.
Yeah, so the dietary history, we see that he takes his cereals in the morning when he takes his breakfast, take his cereals with full cream milk. Yeah. Then he reports having cravings for sugary
foods.
Yeah, like soft drinks, donuts. etc. Yeah, and then finally, he also enjoys dried fruits, some French fries, some donuts, but doesn't like taking vegetables and waters. Neither does he have time for some exercises because of his work schedule. Okay, so
it's obvious that Michael needs to make a number of adjustments.
Yes.
And of course, nutrition is one of the key components of lifestyle.
Yes.
I keep on saying that.
Yes.
And this is actually a lifestyle disease.
Yeah.
Yeah, and so it needs to make certain adjustments. For example, he's taking cereals, which are actually good, but with full cream milk.
Yeah.
Yeah, and if you just look at this milk, you know, it's full of cream.
Yeah, I can see it's shining with fat.
Yeah. So a cream has a lot of saturated fats.
Yes.
Saturated fats actually increase the risk of getting conditions like high cholesterol levels. And of course, that tends to affect the heart. So it's one of the heart diseases that would actually talk about. So he needs to make sure that he gets rid of the cream from the milk. Okay. But of course, there are people who add that cream to other foods, which is also not good. So it doesn't make sense as to why they are getting rid of the cream from the milk. But cream is not that good. Okay. He also needs to make other adjustments, like he's taking, for example,
his donuts.
Yes, donuts. And talking about the donuts, you know, it has saturated fats. At the same time, it has a lot of sugar. Yeah. That's actually a very bad combination.
And for people who take donuts with a soft drink.
Yes, that is a common thing that actually many people do. Combination of the foods is the other thing that we address as nutritionists. Okay. We don't just talk about the right foods. How to take those foods is also very, very important. Yes. So combining a donut and a soft drink is actually a very bad combination. Yeah. It's like petrol and fire. That is not good. And for somebody who has a heart disease, that needs to change. Yeah, that needs to change.
Then how about his liking for French fries and potato chips?
Potato chips and all that. It's obvious that he seems to be liking foods with a lot of saturated fats. Yeah. And that needs to change. Okay. Because, as I said, of course, it increases the risk of getting high cholesterol levels, and that tends to complicate everything.
Okay. Yeah. So then now this is the bad.
This is the bad side.
Bad side.
Yes.
That which needs to be avoided by patients. And then we look at this is the bright side. Eh? Yes. This is literally the bright side. Yeah. And then these are the kind of foods that we are looking at for people with heart disease. Eh?
You can see they have different colors, very good, very attractive. Yeah. And this is what God intended us to eat. Oh, yes. Wow, before like processing actually came. Yeah.
I see we have different varieties of fruits. Mm-hmm. We have combination of mangoes. Yeah. So then tell us, is this why is it important to have combinations?
Yeah. Fruits are very important because first and foremost, they're very good in terms of fiber content. Yes. And they also have certain nutrients like vitamin C
Okay.
that actually act as what you call the antioxidants. And antioxidants are compounds that assist the body to get rid of free radicals.
Can we take this in form of fruit salad, like the way we're having a vegetable salad?
Not a must, because fruits are not supposed to be taken like food. Like you want to take just fruits first as your meal.
They are supposed to be a snack.
Yeah, and they can be a snack, or in case you take with your meal, of course, you need to start with your fruit. But the most important thing is they provide us with micronutrients, meaning we need them in small quantities, but on daily basis.
Okay.
So if you take too much, then you're not assisting yourself, because your body is simply getting rid of the excess.
All right.
Yeah.
So then I see we have spinach here, and we have also some broccoli, and
Spinach, very good, because we keep on saying that we need to make sure that we check 3 meals per day. Of course, vegetables are very important when it comes to our meals. And of course, we need to make sure that we get vegetables such as spinach, because they're very good sources of iron.
iron. All right.
Iron transports oxygen. So in most cases, for people who have iron deficiency, usually the heart has overwork, because iron is what carries oxygen. So we need to make sure that we take care of such nutrients. And that's why such vegetables are very important.
Okay.
They also have fiber.
Yes.
Fiber assists in terms of getting rid of excess fat from the body, especially the cholesterol. So in that case, then vegetables are very, very important. But we can as well, introduce salads.
Yes.
Yeah, because the goodness with the salad is the fact that of course they are not cooked, and they have nutrients such as vitamin C. In most cases, when you take salads, of course, you end up getting some of the nutrients that are actually called water-soluble nutrients that are affected by cooking. And salads, just like fruits, they have what you call the antioxidants. Yeah, that assist to get rid of the free radicals. Free radicals tend to make heart disease worse.
Okay.
And of course, Michael needs to start enjoying these foods, not because they're good, but because he wants to, get rid of this condition.
And of course, the exercises.
The exercise, sorry?
Yeah, he mentioned that he doesn't do a lot of exercises.
Yes, he doesn't like exercise, of course, which makes it worse, because if he likes fatty foods and all that and not exercising,
that's worse.
That is actually worse. So he needs to, first and foremost, as we said, stop the intake of these foods, the fatty foods and all that, switch to these foods, and of course introduce exercise.
And water.
Water is also very important.
One thing I realize about doing exercises is it makes you thirsty and make you want to take water. So then I guess it's important to do exercises as well.
Yeah, so it's very, very important that it increases water. If at all, he also is also going to increase exercise, because when we exercise, of course, our body needs more water in the process. Yeah.
All right.
Yeah, it usually needs more water.
Coming to these vegetables, do I really need to add salt to my vegetable salad?
Not a must. We don't recommend raw salt, because we're also trying to make sure that we prevent conditions like hypertension.
Okay.
Yeah, so what we recommend is, if you have to add salt to your food, then it has to be cooked. Or you can use sea salt.
All right.
Yeah, which doesn't contain a lot of sodium like the table salt.
Okay.
Yes.
So then this marks the end of this segment. Thank you so much for that insight. Thank you so much for your time. And now that you've given us permission to take vegetables without necessarily adding salt, I'm good to go. For our viewers back at home, goodbye. Many people suppose that exercises are unsafe for patients with heart disease. However, this may not always be the case. On the contrary, exercises may be helpful. With the guidance of a qualified fitness trainer and an okay from the doctor, a patient should be able to keep fit. Mr. Nzuki expounded on some of the exercises that are effective and safe. Hello everyone, welcome to Health and Flavor. We are on our fitness segment, and today we're going to look at exercises that are fit for people with heart diseases. Remember that these exercises are good for everyone. On set, we have our fitness expert, Mr. Nzuki. How are you?
I'm fine.
You are going to take us through the exercises that are fit for heart diseases.
Yes.
I am looking forward to this. So where do we start?
For a person who has had cardiac arrest or any other heart disease, and exercise is a good thing.
These exercises are not meant to be strenuous to your heart. So then when you feel strain on your heart, that's the right time to stop. And you should also get an okay from your doctor before you start this kind of exercise.
But that does not mean that you sit and you relax.
Exercises are good for everyone,
Yes, they are good for
whether you're ailing or not,
Yes.
for a healthy body.
Yeah, so today we have a chair here.
Yes, I can see we have a chair.
We'll use it for some exercises, and we can also use it for a support because someone may be feeling some weak.
All right.
So now we'll assume that you are the patient who has suffered an heart disease. So this will be your chair,
Okay.
and we'll start do warm up like this.
All right.
We are stretching the calf and the hamstring.
Okay.
So this is what we are doing. Change. Now for the next exercise, we'll do strength training. And remember, we'll still use the chair.
Okay.
Yes.
All right. So then.
So you'll be our patient, sit on the chair. I'll give you the dumbbells to strengthen your muscles.
All right.
Yeah. Let's go. Give me.
Shoulder press.
Yes, let's tighten. Give me 4 more. Give me 3. Give me 2. Give me 1. Open and close. Give me 5 more. 4, 3, 2, and 1. So this is what we are doing for the abdominis muscles. Just rest slightly at back. But for my friends who are very fit, can go all the way. Good. We have come to the end of our workout for the day.
Wow. All right, so then this marks the end of this fitness segment. For our viewers back at home, keep doing these exercises. You only have one heart. Take good care of it.
Hello, my name is Dr. Fasaz Agay, a general surgeon and a public health specialist. I would like to underscore prevention measures discussed on the subject of the day, heart diseases. Cardiovascular diseases is the term for all types of diseases that affect the heart or blood vessels. Many forms of heart diseases can be prevented or treated with healthy lifestyle choices, such as, number 1, quit smoking. Nicotine constricts your blood vessels, and carbon monoxide can damage their inner lining. Heart attacks are more common in smokers than in non-smokers. Number 2, control the high blood pressure. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, narrowing the vessels through which blood flows. Number 3, control the high cholesterol. High levels of cholesterol in your blood can increase the risk of formation of plaques and atherosclerosis. Number 4, exercise regularly, at least 30 minutes of moderate intensity physical activity, preferable every day of the week. Exercise helps reduce levels of bad cholesterol that form fatty deposit in the arteries and contribute to heart diseases. Number 5, eating a healthy, balanced diet that contains fruits, vegetables, whole grains food such as brown rice and whole wheat bread is crucial to a healthy heart and circulation system. Eating oily fish, nuts, and seeds are good in a small amount. Eat a diet that is low in salt and saturated fat. Number 6, reduce and manage stress. Unrelieved stress may damage your arteries and worsen other risk factors for heart diseases. 80% of the premature heart diseases are preventable. Healthy diet, regular physical activity, and not using tobacco products are the keys to prevention. Checking and controlling risk factors for heart diseases such as high blood pressure, high cholesterol, and diabetes is also very important.
A positive attitude is important when one is ailing. Do not take ownership of disease by saying things like, my hypertension, my heart disease, my depression, my. Don't possess it. It's not yours to own. Instead, be cheerful. Jesus Christ has overcome the world. Yay! One of Helen Keller's quotes cites that, the best and most beautiful things in the world cannot be seen or even touched. They must be felt with a heart. Keep your heart healthy. It has been fantastic to have you with us up to this end. That's all we have time for. I've been your host, Bill Hawaka. See you next time.